my whole world changed. My whole world changed. All of a sudden, I was this very sick, very weak, fragile, emotional lady. And I had a lot of people from Boone that helped me deal with that. I was referred to Boone for some tests. My blood pressure was high. Everyone really thought that maybe I had a blockage and those probably could be fixed with medicine. I had 3 arteries, 98% blocked. A heart attack would have killed me. When the diagnosis was made, within 15 minutes, I had a heart surgeon talking to me. The very next morning, I came over and got checked in and had quadruple bypass surgery. My surgery went great, and I was put on the post-surgery floor for cardiac patients. And they took me and just taught me how to eat right. They taught me how to exercise, how to judge when exercise was okay. They encouraged me when I cried, and they just hung in there with me.
We have the finest staff, from those people that work in every area of the hospital to our physicians. Our quality scores show that. Our patient satisfaction scores show that. I have people stop me on the street and say, I received the most wonderful care at Boone. And that, to me, tells me that we are doing our job at Boone Hospital Center.
I think that we consistently perform and are recognized nationally because we're a great team. Anytime you talk about sports analogies, there's lots of teams that have great players. But the best stories are about the teams that maybe didn't have the hero, but all work together to get the job done. You know, if you do a great job, the person next to you is also going to do a great job. Or maybe if it's not your best day, you know someone else can step in and help you out on that day. I think that our employees feel like they can rely on each other to make a difference. That team approach makes it possible for the organization as a whole to be recognized and succeed.
A few years ago, my father-in-law was very sick at Christmas time, and we knew that it would be his last Christmas, and I was up to work that Christmas. Everyone pitched in their own schedules, and they covered my whole time. My husband and I went back and spent a week at Christmas, and within that week, he died. And I think that just shows the caring that we have for each other, that everybody makes accommodations when there's a need that comes up. It has to do with the fact that we have been a group so long that we take care of each other.
Boone has that great philosophy that they teach at Boone Beginnings that floored me from the very first day. You know, it's not just a place to work, it's a place that has a belief system and a way to treat others, not just others in terms of patients, but others in terms of everybody that walks through the halls, whatever role they play. And that made a huge impression on me when they defined what a customer was and included the co-workers, the employees, as well as the patients. I thought, they're right, that's what it is.
My very first year that I worked here as a therapist, I had a patient. He suffered from Guillain-Barré syndrome. And he was here with me for about 6 months. That patient calls me every year, at least once or twice, and he always credits really our department, but also myself, with saving his life. When you can have an experience like that, I think it really does touch you and make you feel like you're making a difference. And that's really what everyone gets into healthcare for, to make a difference.
I think it's your immediate work area that makes the most impact. Those are your day-to-day people. It's mostly your immediate supervisor and then your staff that you work with. And I've been privileged to have excellent supervisors and great staff. And the doctors, the group of doctors that you work with has a big impact on how you do your job and how satisfied you are in your job too.
Having been an obstetrician for almost 28 years, my fondest memories go back to those times in the middle of the night when I was here and there was a staff surrounding me. They were the ones providing the care. They are the heart and soul of Boone Hospital, and they represent the thing that I carry with me forever.
I have always wanted to be a nurse. I'm directly with the patient. When I'm in the labor and delivery area, I coach them. I am their nurse during probably the most exciting experience that a woman ever has in her life. Postpartum, I am like a floor nurse. I take care of both mom and baby. I like being in labor and delivery primarily because of the difference that you make every day in someone's life. I feel very, very honored to be with that patient for that day because it's a big day in her life.
The nursing staff has really made a difference, especially with having babies. I feel like there are some things that you know, but then there's a lot of things that you don't know, and you really feel kind of a fish out of water. It just makes a big difference in making you feel at home and reassuring you and teaching you. The doctors and the nurses are just so calm, and it's almost like this everyday thing for them. And then you have this baby and everything changes. It was just amazing to know, I had this son and this new responsibility, and my husband, seeing him crying and holding him was just beautiful. I chose Boone, and I continue to choose Boone for a reason, just because I think the level of healthcare is unprecedented in the community. It's just excellent. I just associate Boone Hospital Center with excellent and the best care possible. It's important to me for a hospital to continue to strive for excellence in the sense of not just looking in the community, but looking at medical practices. What's the cutting edge nationally and worldwide?
I just came back from a conference in a big city and sat and listened to lots of people talk about how they care for people, what kind of equipment they have, and I felt good because all of those things were here at Boone.
We were the first community hospital in the United States to have an MRI. That is an amazing feat. Our latest venture with the Da Vinci robot is just an example of how we've continued to maintain that quality of excellence with technology.
Providing high quality is what it's about. You're dealing with people's lives and their health, and there's nothing else more important than treating them with that quality, respect, and compassion. It's the only way to do it.
The care is excellent. It's fantastic, really, because there's so many people that I've seen come back. It feels like they're part of the family, even though they're the patient.
This hospital was built by the citizens of Boone County, and they expect us to help them form new families, to help them say goodbye. They expect us to nurture and heal and show compassion. So that's our obligation.
We had a challenging year last year. We committed to one another that we would not sacrifice our patient satisfaction, our commitment to quality and safety, and we would not sacrifice how we would interact with one another. The three measures that we have, they were all exceptional last year. In fact, an argument could be made each of them moved up during a time that Boone was challenged more than it ever has been. By getting a commitment to one another and then executing on that commitment, I think we showed the real strength of our organization, that no matter what the challenge is, we would meet that challenge.
I think there's definitely a sense of family. People do make bonds. People hang out together away from work. People are involved in each other's lives, so it's not just at work, it's away from work too.
We're a family. It's a Boone family. It always has been.